Good evening, families. Thank you all for joining us, and thank you, Fiona, for the introduction. As we mentioned, we're going to talk all about emotions today, and with an emphasis on what emotional regulation is. We're going to kind of go over some of the neurobiology behind what we understand how the brain and it affects emotional regulation, and why it's harder for our kids who have autism and ADHD to regulate compared to kids who don't have it. And at the end, we'll give us some tips on how we can help our kids and then answer some questions. So we'll go from there. We'll jump right into it. And FYI, this is my first presentation in 10 years. So thank you for the opportunity and bear with me. But I love doing this. It's something I do all day long. And I hope that is helpful for you all. All right. So, what's an emotion? An emotion is a complex internal state. It involves a combination of a subjective experience. And when we think of a subjective experience, that's mostly like what we're feeling, sadness, anger, frustration. And it's also combined with cognitive processes like thinking. What is that person thinking? What is their perception about the event or situation that happened? And it often is combined with a physiological response. Not always, but it can be with a physiological response. And those physiological responses can be like muscle tension, chest feel like your heart is pounding really fast, breathing much more deeply. Some kids have GI distress where they feel nauseous, or their stomach is rumbling. Sweating can also happen, stuff like that. And with the combination of the subjective experience, which is the feeling, the thought process, and with the physiological response, there's then a behavioral expression that happens. And many of you who are here today often might see that in your kids as throwing tantrums, running, yelling, screaming, or isolating themselves. And we'll get into that a little bit too. And so some kids are able to have an adaptive response and some are unable to have that, and it's a little bit more of a maladaptive response. And so we're going to talk about all of that and how to understand when it's a problem and when it's just normal. All right, because I think normal is important to know too. So the next slide goes into, okay, so how do children learn emotions? How does anyone learn emotions, right? So emotional learning is in stages, mostly through developmental stages. So at the time of infancy, it begins, and at that time, infants borrow the regulation from the parents. And parents are often and should be and try to be attuned with their child. And I'll have a little side note on that, that sometimes parents don't realize that they too have had struggles growing up and they didn't realize it until they become a parent, right? So for some people, it's hard to be attuned with your child. And it's okay as long as we become aware and learn about how to handle that. Sorry. So, okay. So infancy, parents, children borrow the regulation from the parents. Parents are often attuned to their children. So then, when they see that their child is in some level of distress or experiencing a different emotion, they'll be able to be present and soothe their child. And the child will then pick up facial expressions. They'll be able to pick up your tone, your voice, and then they will be able to mirror and imitate that. And so that's the beginning of how they're going to learn about emotions. And the rhythm part, as you see there, I wrote rhythm. That is the consistency in the caregiver. So as long as the caregiver is able to be consistent with that over and over, because it will happen over and over, the child will learn. When there's inconsistency, that's when there's risk of dysregulation, and we'll go on to that. And then in toddlers, when they're a toddler at that time, we want to help them identify and label the emotions. So they're starting to learn words at that time. Caregivers, are supposed to just help them identify it simply. I'm going to give you an example of my own son. He's 8 now, but when he was much younger, he was so excited about something and he jumped on the sofa and he hit his brother. So even in his excitement, he did something that was maladaptive by hitting. And I knew because I was attuned with my child that he was excited about something. And so I helped him label. I said, wow, you look really excited, but do we hit when we're excited? And so that helped him identify he was excited. So that's why it's important to kind of be attuned to what they're truly experiencing at that time at a young age. And then we label it for them. And when we label it for them, that's when they get the words for their emotions. When they're sad, they're scared, they're happy, we can simply say, "Hi, you look like you're really excited today," or "You're really happy about this." And then those words, labeling them is how it also begins. Okay. And then us at school age, that's at that age they start to have more capacity to have cognitive processing. They have the capacity to be more flexible in their thinking. So at this stage of development, you want to help them connect the thought and their thinking or perception to something that happened with their feeling. So connect the feeling to the situation. Let's see. So, more common emotions at this age that they start to learn is about feelings of shame, jealousy, guilt. And again, due to this age where they have some flexibility in their thought process, it is a good thing to help them learn about perspective at this time as well. And it is around this time where we do start to see challenges in our children who have autism or ADHD. All right. And then in the adolescent years, they start learning more about their identity, about their peers. They have struggles with impulse control. And in children with ASD, autism, ADHD, and even normal adolescent development, there is a poor impulse control. Why? Because the prefrontal cortex, and we're going to go into that, is not developed fully until age 23. So we're going to see a lot of impulsivity, and sometimes it's easy to label, oh, they have ADHD, or oh, something's wrong with them. But remember, it could be very normal too, right? So that's important to kind of separate. And then we'll talk a little bit about that too. All right, which is now. So regulation versus dysregulation. Now that we understand what emotions are and how children learn them, as caregivers and parents, we must be able to understand what is normal and what is a dysregulated state. So, as a reminder, I like to say, like, we're all human and we are created with these emotions. Therefore, having emotions is normal. Having big emotions is normal. And emotions are valid, right? Whatever emotion your child is experiencing, whatever emotion you're experiencing, it's all valid, including the emotion of anger, which often is, tend to be shut down, right? So, emotions are valid, they're normal. But how do we separate it and say, when it becomes a dysregulated state? So I'll give a quick example. A child can be intensely angry and still be regulated. And that is seen by they're still capable of being safe. They're able to communicate, and able to kind of get through it, right? So in stages. And so the slide that's showing here is, regulation versus dysregulation. So emotional intensity is not the same as loss of control, right? And so the intensity, even though it's big, as long as they're able to be receptive to the caregiver, they're kind of calm and present in the state where they are able to identify what they feel, or even allow the caregiver to help support them. That will help shorten that duration of that intense and big emotion, and the flexibility. The child is able to kind of shift from what they're experiencing and what they're feeling by pausing or even maybe utilizing a coping skill. But when it becomes loss of control, that's when it's becomes a very unsafe situation, and we'll go into that too. Kids can look very impulsive at that time. They could be very rigid. They can shut down. They can bolt and run, and that's more of a dysregulation. So far, any questions? And I know there's a lot of questions down the road, or should I keep going, Fiona, until the end?
Yeah, you can keep going.
Okay, okay. I tend to ask that during my sessions with patients, so I think it naturally came out. Okay, so the next sign is or next slide rather, is another way of helping parents and caregivers separate, what is regulated and versus dysregulated. So some body cues that you can look at is when they're regulated, they can still be tense, but their breathing will be normal, and they might be able to use a coping skill. When it's dysregulated, it's maybe high racing heartbeat. They feel shaky. They're sweaty. They're also tense, and maybe they're breathing heavily, stuff like that. What does the behavior look like? So, a regulated kid might protest or negotiate. And some parents actually don't like when the kid is protesting or negotiating with them. But it might be a good thing because that means that they are still intact, you know, that they're still connected. Their brains are still connected with their emotions. And so if they're protesting or they're negotiating with you, it might be good to look at it from a different perspective as like, okay, they're angry or they have a big intense emotion, but they're not dysregulated. They're still regulated. So that's important. And even in these times, sometimes kids ask for help. They say, Mama, I need a hug, or, I need to go for a walk, or whatever it may be, And I think I read in one of the questions is one of your child wants to find his own coping skill. And we can kind of talk a little bit about that too, and depends on the type of coping skill. So that's good if they're able to express in these big, intense emotions that they have a coping strategy that they'd like to do, or if they're negotiating with you. So that's a positive thing because it shows that they're still regulated. When it's a dysregulation, the behaviors will be aggression. They're going to be running. Another question I saw from a family was, when my kid starts running away and, is really upset, some people externalize by yelling, screaming, damaging property, punching walls. Other kids internalize it where they just want to isolate themselves. They just kind of are staring off, and those behaviors are cues for us as parents to know that, this is a behavior where they might be dysregulated. And then thinking, we can look at and assess their thought process at that time. Are they able to hear kind of what you're saying? Are they able to have a conversation? Are they able to, like we talked about negotiation, so if their thinking is there at that time, they know that they have some choices when they're feeling in, the intense emotions, that's a sign of regulation. When they're dysregulated, they're not able to fully think through clearly, right? So they're saying things that are quite intense. They're very rigid in their thought process. It's all this or all that, They might make threats to hurt themselves. They might make threats to run away. That is a cue for the parent to know that at this point my child is dysregulated. And then we will talk about how to help them at that time. Um, and recovery. So kids who have these big, intense emotions, whether it's anger, which is one of the more common ones, aggression, their recovery will come in a shorter time frame than kids who are dysregulated. So in a dysregulated kid, there will be a prolonged escalation. The child is exhausted emotionally, the families are emotionally exhausted, and the cycle can repeat over and over, right? But with a regulated child, when they're angry or frustrated and have these big emotions, with the support from the parent or the caregiver, the time frame will, kind of be short and they'll return back to the baseline. So those are some cues we can look at in our kids to know if this is a true dysregulation or just a big emotion. All right. And then here's another kind of part three of that, like the arousal window, right? So let me see. Okay, so when a child is connected and calm, they will be alert, they are engaged, they're playful, they're able to learn. And it's at this time when your child is connected and calm that you can help them learn a coping skill and problem solving. When your child is manageable yet still activated, like they're angry, they're frustrated, but you can manage them. They might be frustrated, a bit more anxious, but they're still able to respond to coaching. This is a good time to try to do that. You can help them with breathing, maybe going for walks, talk about some collaborative problem solving. So those are good. That's like the second from the top. And then the third from the top is when they're in the fight or flight, right? And that is when it becomes a dysregulated presentation. So if your child is having a big, intense emotion and they are yelling, screaming, they're saying things that are nonsensical, that don't make sense, they are panicking, that's when they're in that state of fight or flight, which is part of the autonomic nervous system, and they're essentially in a sympathetic overdrive. And again, we'll talk about how to help them when they're in that. Another part of the autonomic nervous system is that last picture there where the child is frozen or in a shutdown state. So I mentioned earlier, some kids internalize and some externalize. So the freeze shutdown state is when they're, become very quiet. They want to isolate. They feel numb. You see avoidant patterns. They might even dissociate during that time. Again, things that are not making sense. They might say things that are nonsensical. So again, just a little highlight that I wrote here for my families to remember that dysregulation is not always loud and external. It can also be very quiet and internal. So those are things to think about when you see your child. Um, all right, and now we'll talk a little bit about the neurobiology. So, how does what do we understand about neurobiology and how it affects or participates or works together in our children's ability to regulate their emotions? So first, I'll just say that the regulation is not located just in one part of the brain. It emerges from networks linking together, linking the emotional part of the brain, the memory part of the brain, the executive functioning, and body arousal. So, for example, the limbic system. The most vital component of the limbic system is the amygdala. Many of you may have heard of the amygdala. This area of the brain is the emotional center of the brain. And it's in this area where our our minds are able to really assess the severity of an emotional experience, and then it moves on into kind of the memory cortex, which is the hippocampus part, and that hippocampus part of our brain is the memory. So if there was an intense emotional experience, that gets stored into the hippocampal part. So many of you may have heard of the body keeps the score, so that's the memory is there of an intense emotion. And then the prefrontal cortex and the limbic system kind of work together and they have to communicate. So the prefrontal cortex supports inhibition, planning, perspective taking, and it helps with the top-down modulation, right, from the limbic system. And the prefrontal cortex is what I mentioned earlier, that is like the last part of the brain to develop. So even if a patient doesn't have autism or ADHD, in normal child development, you will see impulsivity during adolescent years. And then again, the memory context that I talked about, this is the role of the hippocampus. The hippocampus helps place those emotional experiences into context and it keeps the memory there. It also helps to remember if something was safe or not. I wrote an example. If someone was in a traumatic experience with a very severe emotional experience that followed, the brain will keep the memory stored there. And then last is the body systems. For example, the autonomic nervous system, which I had mentioned earlier, and the HPA axis system, which is the system that also connects with the autonomic nervous system. We'll talk more about that in a second. So these areas translate emotional meaning into a physiological state. So earlier I talked about one part of an emotion is a physiological state or a physiological experience, So when all of those things happen in the brain, the brains are connecting. Through these systems are when people may have physiological responses like the shortness of breath, the sweating, chest tightness, shortness of breath, stuff like that. All right. And then, okay, so first we're talking about the amygdala. So the amygdala, just a little bit more deeper into this is like the threat scanner, right? The amygdala rapidly detects the intensity of an emotional experience, especially a possible threat. It can be activated before conscious reasoning could fully evaluate the system. So my example of this is our bodies, our minds, the amygdala is able to pick up if something it's quite intense, right? An emotional experience. And before we even know what's going on, that part of our mind is activated. So sometimes that's when you see kids when they're dysregulated, right? They can't figure out what's happening. And a good example of that is like if you're at your office, your workspace, or at school, and the alarm goes off, we don't know what's happening. We just know that the alarm is off. And so that's what's happening essentially to the kids, that the alarm is off and they have no idea why, but something went off in them. And that's like the threat scanner part of the amygdala. When the amygdala does appraise for danger, it coordinates with the hypothalamic and brainstem, sorry, pathways to mobilize either the fight or flight or that freeze. So that's when we talked about some kids are externalizing and some are internalizing. With chronic stress, trauma, anxiety, irritability, or neurodevelopmental vulnerabilities, there is a lower threshold for amygdala activation. So, meaning kids who have autism or ADHD, they have less ability to have their amygdala activated. So another meaning is a child who appears oppositional, maybe operating from a threat physiology, right? So the alarm went off, but it looks like it's defiant. So creating a safe environment for them, and helping them decompensate or get back to their baseline is going to be the very first thing that you'd want to do. All right, and then, all right, so I have some big notes here. Okay, so the prefrontal cortex is the brain's coach essentially, and that helps children pause, it helps them think, and really choose how to respond to big feelings. The hippocampus, like I mentioned, is the brain's context memory, helping them to differentiate between real danger and a past scary experience or a past stressor. So that they can have, an appropriate reaction to the situation. Let's see. So one other thing to note here, and I won't go into too much more detail, it's important for all of these brain regions to connect. And through all of their connection is when a child will be able to have the ability to regulate their emotions. Um, so and then just their last two parts, the body systems that we're talking about, the autonomic nervous system. Now, this is a really important system to understand. I know there's a lot of talk about this out there nowadays. A lot of people who have trauma, are often in a sympathetic overload as well. A lot of people get missed in their diagnosis because, trauma is not really assessed. But essentially, the autonomic nervous system has two parts, the sympathetic nervous system and the parasympathetic nervous system. So, the sympathetic nervous system is that part of our body that is supposed to tell us how to respond in a threat, essentially, right? Like you're in the woods and there's a bear and you got to run. But unfortunately, in this world, there's a lot of people are living in a sympathetic overdrive. And so people are constantly in that fight or flight. And then individuals who have autism actually tend to also be in a fight or flight because of the lack of connectivity in their brain development. So they're often also in a sympathetic overdrive and have less access to the other part of the autonomic nervous system, which is the parasympathetic nervous system. The parasympathetic nervous system is like the calming center of our body. By going out for walks, movement, sunlight, holding cold ice, there's science behind this that it helps activate the parasympathetic nervous system to help calm our bodies. And so these are important things to understand when a child is going through a big emotion, and they may become activated in the sympathetic overdrive. And one way to help them is by activating the parasympathetic part, right? By going for walks, holding cold ice. And again, we'll talk a little bit about that too later. And then there could be mixed states, where they might have moments of freeze and panic and isolation, and so they're kind of teetering and vacillating between the two. So that's going to be an important distinction to assess in your child. So that will then better help you be prepared on how to help them and manage them. And then just some brief parent strategies that were noted here. Again, focusing on calming the body by using deep breathing, movement, such as walking, exactly what I was saying earlier, calming the sensory input, calm even our own speech and tones will be helpful for our child, getting exposure to sunlight, and then again, holding something cold all activates the parasympathetic nervous system. And then the last body sensation, the hypothalamic pituitary adrenal axis and stress hormone. So this is another important part of the neurobiology that is all involved in emotional regulation, and it's the brain stress response system, which is the HPA axis. So when the child perceives danger, stress, frustrations, feelings of being overwhelmed, all these big emotion, the brain sends signals to a stress hormone that many of us have heard of called cortisol. So when small amounts of cortisol is secreted, that actually is helpful for us. It helps us and the children respond to challenges. But when there's repeated stress, chronic and persistent prolongation of having increased HPA access, increasing the cortisol, that's unhealthy. And that's when it becomes overactive, and that's when kids struggle with being able to regulate themselves. All right. And let's see. I'm on the next slide. Okay. So, I kind of talked about this, I think, as we were going through the normal neurobiology, but I'll just kind of briefly touch on it here too. So, the key differences in children who have autism with their neurobiology, sorry. So, as I mentioned earlier, the frontal lobe, the prefrontal cortex, and the limbic system, which is the amygdala area, they need to all communicate. And unfortunately, in children who have autism and ADHD, their connectivity and development of their brain is very different from a child who doesn't have that. Sometimes they say in research they found that the amygdala is quite enlarged, or the connectivities between the frontal lobe and the limbic system is not there just yet, or it takes much more time for it to develop, and the connections may never be fully the same. So because those connections are not the same, that puts kids who have autism and ADHD at a higher risk of having emotional dysregulation, right? And having a hard time regulating themselves. Um, and then again, like I mentioned earlier, the autonomic nervous system, kids with autism tend to be in an already sympathetic overdrive and struggle with accessing or activating the parasympathetic nervous system, again, because of that lack of connectivity during their brain development. And they vacillate between those things. So frequent vacillation from very quickly feeling, high energy to becoming low, bored to feeling high stressed or overwhelmed. So they just it's really up and down, and that can appear as very dysregulating. And then one key note, though, is the difference between a kid who has autism and a kid who doesn't have autism, and there's an emotional dysregulation. The reason for the child who has autism having a big, emotional feeling or a dysregulation is because of the sensory cortical processing that is abnormal. So you see kids who get really dysregulated with bright lights or loud noises, right? That's what triggers the kids who have autism. And that's when they become mostly dysregulated. Compared to kids who don't have it, it's because there wasn't that connection of learning an emotion and learning how to regulate themselves, right? And through supports and caregiving and stuff like that, and through sharing, from the parent. So that's a big difference. So when we see a kid who has autism and they're having a big emotional outburst, or there's some dysregulation, most of the time it's part of the atypical sensory cortical processing. Let's see. So here are some therapies to actually strengthen the neural connectivity in kids who have autism and ADHD. So even though their brain connectivities and brain development is different, and it can't cure it, but it can improve that neuroplasticity over time, which can help improve their capacity to regulate themselves better. So applied behavioral analysis, occupational therapy. So ABA helps with communications and coping skills. Occupational therapy improves sensory processing and regulation. Speech therapy will help them be able to better express themselves and their needs. Cognitive behavioral therapy helps with that rigid thinking, so it allows them to be a little bit more flexible in their thinking. Social skills will help with building emotional understanding and having relationships, improving social cues. And then parent supports and parent training really teaches families how to support the regulation at home. And then, of course, CogLeap's interventions, the HFS, which strengthens resilience, emotional awareness, and self-regulation, and the focused treatment strengthens attention, executive function, and emotional control. So there are some interventions here that can be helpful as well. Other interventions can be executive functioning coaching or even psychopharmacological intervention, which is mostly my role, right? And so when do we decide a kid needs some medication? In autism, if you think about a big tree, the trunk of the tree is the autism, and all of the branches of that tree are the co-occurring psychiatric conditions that are often seen in individuals who have autism. And medications would be used to treat those co-occurring conditions. For the large trunk of autism, it's mostly therapeutic interventions like ABA, occupational therapy, speech therapy, stuff like that. All right. And then, okay, so moving along to teaching some regulation skills. Basically, making the core teaching point here is that children learn regulation through repeated, consistent experiencing of being regulated by a safe adult. Co-regulation is not permissiveness. It repairs and calms the child and helps foster a safe environment. Let's see. So I'm just going to read off the slide because it's more organized here. So caregivers regulate themselves first, as I talked about. You want to reduce your verbal intensity. You sometimes want to come down to their level, reduce your tone, because they're learning from you. You want to soften your facial expressions, and that will help them kind of learn to regulate, and the child will match that. And then it's so important to, and I hear from colleagues, friends, patients, I want my child to have thick skin, and yeah, I get it. We want them to all have thick skin, but we can't teach them while they're dysregulated, right? And so step one is so important that we want to help them kind of become, back to their baseline, help them with that acute dysregulation at that time. And then an example is, by helping them identify their emotion, right? I know you're upset. I love you. I'm here with you. You are safe. So connecting with them, helping them get back to their baseline, reduce the load. If there's a lot of people in the room, you may want to, get people out of the room. If there's a lot of noise, maybe reduce the noise and monitor our own language when we're talking to our kids. Because, if we're upset, then they're seeing what's happening with us. And again, they're going to mirror that, right? And so it's important that we check ourselves and check our language as well. So the goal at this stage again is acute stabilization, not insight. We're not teaching them at this time because they're not going to get it. We have to bring them back to their baseline. Again, repair later. After recovery, then review the events. Sometimes it could be the next day. Sometimes it could be a few hours later, And during this time of repair, you want to try to help them identify and label what they are feeling. You want to try to see if you guys can identify triggers. And then, talk about how you can use a coping skill or help them learn a coping skill and even practicing it with them during that time. All right. And then a few more things. I feel like some things are kind of repeated here. Label their observable cues. So, for example, when they're dysregulated, again, labeling is so important, helping them learn. Your fists are so tight and your tone is really loud. I wonder if this is frustration. Again, you're helping them see what they're doing, like if their fists are really tight, and that's connected to, a level of frustration. So helping them, identify and label emotions. And then validating them. Validation is so important because it's what they're experiencing at that time, So validating what they feel, you look like you're disappointed or you're frustrated. It totally makes sense that you're upset about this, but the limit is that you're still not going to hit, So you're telling them that you get it. They're frustrated, they're angry, but the answer is still no. You're not going to get your iPad today, or you're not allowed to hit, but I get it. It's frustrating, so labeling and validating their experience is so important, but then setting the tone on what the expectations is okay too. And then linking triggers, that's another important thing. What triggered your child? Help them connect with the situation, and help them connect with what they're feeling at that time. What were they thinking at that time? And again, perspective is so important. So when they get a little bit older, helping them understand perspective is important too. Like, could it have been this or this? And that may change how they feel about certain things. And then using simple language and again, consistency of the parent or caregiver will also be and is very important. So teach emotion, words, and coping plans outside of the crisis, so not during the time of dysregulation. This dysregulated brain cannot easily learn new language or logic, which is understandable. So, okay, did I do that too fast? Now, Fiona, am I okay to ask questions or start reviewing some of the questions here? I didn't highlight a five, but I feel like I can answer most of these if you're okay with me doing that, just
Uh,
running down them.
yes.
Okay. So, when a meltdown is caused by a task, what's the best way to help your child get through it? How long of a break do we take to reintroduce? Okay, so I think I hope it went through in the slides here too. When a meltdown is happening, is this a dysregulation or a normal big emotion? Usually, if it's a meltdown, it's probably labeled as a dysregulation. So remember, step one is helping them get back to baseline by kind of letting them see what you're doing and helping them. Sharing your ability to regulate will be helpful for them. Bringing yourself down to their level, calming your tone, labeling their emotions, giving them the support, seeing if they're able to kind of utilize a coping skill and once they get back to their baseline. So once they get back to their baseline and you guys are able to kind of talk things through, you can ask them to say, hey, do you feel ready to, start the task again? It will differ from child to child. If your child is having multiple breakdowns or meltdowns on daily basis and they're extended periods of time, then yes, of course, it may take some time to reintroduce the task. But if it's happening infrequently, a couple times a week, I think it'd be fair to say, there's no exact time. Like I could say, hey, 20 minutes or 30 minutes. I think by assessing your child's ability to get back to baseline would be the answer that you can look for. And if they're able to get back to their baseline pretty fast, then maybe at 5, 10 minutes or within that, hey, you ready to get back on the task and see what they say. And the kids are resilient, so maybe they're able to do it. So I hope that answers that question. Um, my child has really big emotions very often, but he only wants to regulate it by himself. No other suggested methods worked. If so, should we give him his own way? I guess it would be really hard in school environment. Okay, I like this question because to me, this child is having big emotions, which may be very valid and not dysregulated. The fact that he's saying, he wants to use his own method. Is good. I mean, it's in a way he is challenging you guys and he's, kind of negotiating. But of course, I don't know the whole context to it, right? So, but based on what you wrote here, I think if his method of coping is an adaptive method and not a maladaptive method, and it is within the rules and expectations of the family and the home, it might be okay. As far as doing it at the school, again, the child needs to know we will allow you to have your own way to regulate as long as it's within the expectations of the school or the home or if it's allowed. But the fact that they are negotiating or protesting, to me, that shows that they're still intact and it's a big emotion, a valid big emotion, and not a dysregulation. So I hope that helps answer that. Number three, how do you teach child to manage big emotions when they say nothing works and they only feel better when they hit something or run away? Okay, so great question here too. I hear this all the time. The kids are like, we've been in therapy for years. I've tried everything and nothing works. And so there's some level of subconscious, not, willing or able to kind of fully engage in that. Some kids need maybe medications to bring down the severity and the intensity of those, emotions or symptoms before they can then engage in the coping skills. So that would be an important thing to assess with either their therapist or the psychiatrist to make sure that the severity and intensity of the emotions, are reduced so that they can then engage in a healthy coping skill. And when they want to hit something or run away. Okay, so hitting something, obviously we don't want them to destroy property and we don't want them to run away from the house. But holding a stuffy or a stuffed animal, I guess they call them stuffies now. I called them stuffed animals back in my days. So holding a stuffy or, squeezing the pillow or punching the pillow. I think that's okay as long as they're not harming themselves or destroying property. I think that might be okay. So you kind of have to look for the balance in between, right? Let me look for the question again. So yeah, hitting something. We're not breaking things. We're not breaking property. But we can squish a stuffy. We can punch a pillow. Those might be okay. So again, within the appropriate adaptive things. And running away, instead of running away is I don't think ever good, but maybe taking space, maybe going for a walk, if it's within the house or the apartment or where, the complex, finding a place where the child can be maybe observed and they can walk or pace back and forth in the home. But running away is obviously not it's a maladaptive way of coping. So finding something in between, working with your child to say, well, obviously running away is not going to work, but maybe we can go for walks, something like that. Okay, so number four, how to deal with the kid perfect at school, but having issues such as cursing and yelling at home when parents try to restrict screen time, even after agreed beforehand. I love this question because I think it happens to probably all of us, right? Where the kids just don't want to give up those screens. And guilty here, even, in this field, knowing all of it, we're parents and we're not perfect. So be a little bit gentle on yourselves as well. But I will say in that question, if your kid is good at school, that's good. And the fact that they are challenging you at home, yeah, it's not good that they're yelling and cursing at you. It's never good. But if we look at it from a different perspective, they feel safe with you. They feel safe to challenge with you. They feel safe to negotiate with you. So in some ways, what I'm trying to say is that they are intact and it's a big emotion that they're feeling and it's not a bad dysregulation. So talking with them, simply saying, hey, like, I know it's frustrating. I know you don't like it, validate their emotion, but you're not cursing at mom or dad, and you will only get it at this time, or they can earn extra time, or privileges will be taken away if they don't meet the expectations. And I always say if you want them to achieve something like a privilege, it should be an achievable goal. Don't make it too hard for them because that will lead to demoralization. So make it achievable. So I hope that helps answer that question. Fiona, am I okay on time?
Yes.
Okay, cool. How to teach kids to express strong emotions in appropriate ways at school. Okay, yeah, this is a good question too. Nowadays kids are seeing everything and anything on social media and they think everything's okay to say, especially with these shorts and memes and I don't even know what else is out there. But again, talking to your child, being like, hey, you know what? At school, at work, in these places, we don't talk like this. We don't use foul language. They might be hearing parents at home cursing, but it can be a good opportunity to talk to them and be like, hey, when I'm at work, I don't curse. When I'm in this situation, I don't do this. And so kind of helping them understand social norms is very important, that in school, in workplaces, when you're with your friends, these are things that you can't really say because it can lead to getting in trouble. But let me reread that question. I feel like I might be answering it. How to teach kids to express strong emotions in appropriate ways in school. Okay, so I'm sorry. I thought I misread that. Um, so yeah, again, talking to them, having maybe some therapeutic interventions, having a therapist help them identify, you as parents and caregivers help them identify the emotions, and then finding ways to cope and talking through it with them. So I hope that helps. And schools should be able to provide supports too. And if a patient or one of your children is diagnosed with ADHD or autism, they have legal rights to have supports in the schools as well, services that can be helpful for your child. So that's another part.
Hi, Sarah. Some parents are raising their hands for
Okay.
questions.
Okay. So where do I find that in the note in the chat? Let me open that chat up. Okay.